What does it take to be the best plastic surgeon? You hear this in our society all the time. Everybody wants the best. First of all, I don't think there is a single the best plastic surgeon for even for specific procedures, but there is a specific group who are at the top of the game who do all the right things for their patients. And what does it take to be in the best plastic surgery group? It's a few things. It's not just one. One thing I hear about patients saying is board certification. And yeah, it's important to have good training, and board certification qualifies that you've had adequate training, but that's not nearly enough. And I think all of us are board certified. It also takes the ability to take that foundational training that has taught you how to be a surgeon and actually apply it practically, in addition to having the innate skills. You can practice surgery and you can get better, but sometimes you just don't have those innate skills. So it has to be the training, it has to be the innate skills to actually be a good surgeon. But that's just the scientific part. The other part, especially when it comes to plastic surgery, is the artistic part. Because in plastics, we always say things like the golden ratio, proportions, ratios, and if you only apply that scientific part, it can help. Those are guidelines, but they're not enough. We look at really beautiful people and we apply this golden ratio to them that we know is supposed to make things beautiful, and it doesn't work. They actually look worse. So we can't just use that scientific part. The artistic ability is also, it's something that's innate, but something that surgeons can develop with time. You have to figure out what actually looks good, because you can't apply the same principles to every single patient. Every single feature on every individual patient is different. So you really have to decide, is this going to look natural? Is this going to look good? I personally spent years just staring at patients and at people out in public, beautiful people, celebrities, and wondering, why did they look good? And you'd be surprised. A lot of them don't have ideal features. Sometimes their noses are very unideal. Their facial shape is not that perfect heart shape, but they're still attractive. So we have to figure out why, and there's so many different factors, and sometimes it's just because it does look good. So that artistic eye is a very important component. The last part is the willingness to do the right thing for your patients. And that's a really big one, because you can have the training, you can have the ability, you can have the artistic eye, and you could know everything. But if you're not willing to put in the adequate amount of effort, then all of that is a waste. And I find this to be especially true with rhinoplasty, because when it comes down to it, you can know all the other parts, and some of the procedures and little specific maneuvers in rhinoplasty, they can be difficult. They could take longer. Sometimes my case is 30 minutes, sometimes an hour longer, because I need to do what I need to do to be able to walk away and know I've done everything in my power to give them the best possible result. And so you have to have that willingness to put in your full effort. Treat patients like they are your family member. Treat them as if they're family members and going to another surgeon. What care would you want for them, or what care would you want for yourself? So each one of these components is not enough. They all have to align together. You have to have the training, the ability, the artistic, and the willingness. And just one of them is not enough, because if you're willing to do it but you're not able, it's not enough. If you have the education but you're not willing to do it, also not enough. It's a waste. So it's really that alignment of all the aspects to be the best and to be at the top of the game and give your patients truly the best possible results.